Behavioral therapy can be seen as a general category of approaches to therapy, but within it are many approaches which are very closely related. It has its historical roots in the 17th and 18th century European age of enlightenment, and has evolved from theoretical writings and empirical studies from behavioral-oriented psychotherapists. A big distinction in behavioral therapy and what sets it apart from other approaches is its primary focus on scientific methodologies and scientific rigor, and considers its approach to therapy to be scientific. This is different than my previous video on psychodynamic therapy, which in many ways is on the opposite end of the spectrum of scientific. In the behavioral approach, behavior is changed in two primary ways. The first way is through stimulus control, that is an antecedent that is used to elicit behavior. This is like when we use treats for our pets and we shake the bag and our pet starts begging for a treat. And the other way is through consequences. This is often seen in sports where you get basically a timeout if your behavior is not appreciated or goes against the rules. So as you can imagine, behavior is the primary focus, if not the only focus, in many behavioral approaches to therapy. And the goals are to make changes in behavior. And with its scientific focus, these behaviors are monitored with methodological rigor. Behavioral therapies and approaches to therapy use many different change tasks to achieve these goals. And some of them are so popular that they're almost basically mainstream, where most people have heard of them. Common example of this is CBT. Most people know that that means cognitive behavioral therapy. And within that approach to therapy, there are a lot of popular tools like progressive muscle relaxation and thought records. Many of these strategies and interventions have been empirically tested and have shown to be effective far beyond any other approach to therapy. And the empirical evidence continues to grow as it continues to be developed and tested for effectiveness. And so if you consider yourself to fall into this scientific view or perspective, and you, as the famous philosopher Nietzsche puts it, assume the fundamental idea that truth can be achieved, then behavioral therapy and its many approaches may speak to you. Hopefully you can see that I am biased, but I will do my best to remain neutral and try not to influence you, the viewer, as I describe this theoretical framework. However, I've probably already failed to do that. Like I mentioned in the summary, behaviorism has its historical roots in the 17th and 18th century age of enlightenment. This is when rationality and objectivity were championed over opinion and divine authority. And it was a big break from religious ideologies. The real stage setter for behaviorism is often argued to be John Watson, who wrote a now famous article in 1913 called Psychology as the Behaviorist Views It, where he, Watson, stated that psychology as the behaviorist views it is a purely objective branch of natural science. Its theoretical goal is the prediction and control of behavior. This was a huge shift in the therapy world, as emotions were now being looked at as visceral bodily reactions rather than transcendental experiences. Watson and other psychologists at the time wanted to put behaviorist psychology purely in the empiricism quadrant of epistemologies. Now here's a fun little side note. Watson's graduate professor at the University of Chicago predicted that in 1910, the term consciousness would one day disappear from psychology, just like the term soul had. So you can really get a feel that this is really the start of when psychology and the therapy world was leaning and starting to shift towards trying to be a hard science. However, if you're aware of the contemporary issues with replication crisis in psychology, you'll know that this still hasn't completely been achieved. Now, a point that is often glossed over is that this shift towards a more objective view of describing human behavior was done so with the hope that it could be a lot more profitable in the psychology world. You can see this play out today, where most large organizations or government programs will always lean towards an approach for some sort of mental health service that is evidence-based. To demonstrate this approach and to bring more light and attention onto behaviorism, Watson and his colleague Rosalie Rayner famously conditioned a fear response in an 11-month-old child by repeatedly ringing a bell while simultaneously presenting a rat. Now, the rat did not initially bring a fear response for the 11-month-old child, but after 7 repetitions in 2 sessions, 1 week apart, the baby had now developed a fear response towards the rat. This is, of course, completely unethical and could never be done today. The parents actually did remove their child from the experiment shortly after because Watson wanted to continue these experiences. From my perspective, I'm really not sure why one human would want to condition a fear response within another human. Perhaps seeing emotions purely as bodily visceral reactions helps you to do so. Either way, Watson continued on and conducted an opposite version of this experiment at a children's institution. In this experiment, he deconditioned a fear response by presenting food to a child who was hungry while the feared object or feared stimuli was brought closer and closer until the child became desensitized to it and was happy about the food being served and no longer feared the object. I do have to admit, I find it odd and disturbing on some level reading about these old school psychology experiments. And in these 2 examples specifically, I have to assume that the children did not consent to be in these experiments. After the success of these experiments and the proven changes in behavior, it is said that Pavlov's 1927 classical conditioning principles were now being applied to therapeutic ends. However, there still really wasn't much of a following for Watson and his colleagues at this time, and it took almost a decade later until 1935 before 2 researchers, Hobart and Willie Maurer, did a now famous treatment program for childhood bedwetting. What these 2 researchers did is put a special pad under an infant's crib where their mattress, and when that pad started to get wet, it would ring a bell, awaking the child to let them know that their bladder was full so that they could go to the bathroom and not completely wet the bed. This technique became so popular, it actually made its way into mainstream commercial products and is still in use today. I'm grateful they opted for a bell instead of a shock in this experiment. It still took some time, however, for behavioral principles to become widely used in treating human suffering. I can't imagine being the pioneers for something like this, who were doing the research, finding these new approaches and techniques for understanding how to treat people's psychological and behavioral challenges, but having to wait so long for the rest of the world to see it and for the rest of your own discipline to catch up. But eventually, the world did catch up, and it is argued that B.F. Skinner's landmark book, Science and Human Behavior, that made operant conditioning really popular in the therapy world, showing how we can make real changes in people's behaviors with consequences. I think it's important to note, and perhaps you're already thinking this, that operant conditioning does not work for every single person. It can't be universally applied. Our legal and corrections systems are prime examples how some people, for various nature or nurture reasons, do not respond to consequences and can't make changes in their behavior. What also helped make behaviorism more popular was when Hans in 1952 published a very blunt critique of psychotherapy and the state of psychotherapy, particularly focusing on the psychodynamic approach. My previous video, which you can check out here, was actually all about psychodynamic therapy, and I go full depth into that framework. But Hans tried to argue that psychodynamic therapy, or as it was often referred to, insight therapy, was no more effective than a placebo effect. It was later understood and recognized that this critique was exaggerated to some degree, but it did stimulate considerable interest in behavior-based therapy. At this point, and as the years went on, more and more psychotherapists who were growing increasingly dissatisfied with the psychodynamic approach and similar approaches and sort of the overall state of psychotherapy became a lot more interested in behaviorism, and it is especially those who were working at large institutions or like homes where there was a lot of clients and residents. For example, most psychiatric institutions and sort of any large mental health organization at this time was starting to adopt token economies. And this is where desired behavior for patients or residents were rewarded with tokens, which could be used to access additional goods or services. In 1958, Wulp started treating anxiety disorders with a technique that we now refer to as progressive muscle relaxation, which was found to be effective because it allowed individuals to create the opposite feelings of anxiety within themselves to alleviate symptoms, especially during things like a panic attack. But as you can see from what I've discussed so far, from the examples, and there are plenty more, that many people helped shape behaviorism and bring it into mainstream or become widely used. So it's hard to consider behaviorism the product of just one individual or one person, but it did achieve its goals of applying science to human behaviors. That is, it brought forward an analytic, objective, empirical approach to therapy. And I'm sure many therapists and clients are grateful for that, because in my opinion, no one theory or framework will work for everyone. And clients should have a choice or at least a voice in which approach suits them best. Now that we've covered the history, we can dive into the rationale behind behaviorism. Behavioral therapy's rationale is that problems in our lives, problems in clients' lives, are best dealt with in a precise, methodical, and practical manner. Since we use scientific methods to find solutions to problems in the natural world, behaviorists argue that we should use these same methods for finding solutions to personal problems like depression or stress. Although thoughts, feelings, and beliefs are acknowledged to be part of the human experience by behaviorists, they cannot be objectively measured. And so behaviorism wants to avoid them as much as possible in their efforts to solve people's problems. This isn't just theoretical. There is strong evidence supporting that when we change our behavior, our thoughts and feelings will be influenced and changed as well. I'm sure people can think of examples of this in their own lives. If we've been putting off fitness goals for a while, but finally started making changes in our behavior towards those goals, how we think about ourselves and how we just feel overall will be influenced positively. A behavior therapist is less interested in the talk part of psychotherapy or talk therapy and is much more interested in their client doing something about their difficulties. And so talk is used to help motivate and enact that doing. So this kind of leads us to the next section, which is the goals in behaviorism. The sort of overarching goal in behavioral therapy is the elimination of unwanted, problematic behaviors. This is achieved by introducing and strengthening desired or more adaptive behaviors. Speaking of adaptive, this actually relates to a video I made on defining mental health, which you can check out here. But specific client goals are focused on after the therapist has assessed the nature and extent of the client's problems, and the behavioral goals are specific, measurable, and achievable. By being precise like this about the nature of the client's problems, the behavior therapist can then decide if an intervention that has been proven to be effective can be applied for the clients, or if the intervention needs to be tailored or tweaked based on behavioral therapy's learning principles. I just want to say cognitive behavioral therapy, or CBT, is a really good example of this sort of structured, laid out plan that's already in place. Oftentimes, especially with things like depression and anxiety, CBT has like an 8 or 10 week layout of what each session is going to look like. A big benefit of behavioral therapy being so specific and measurable is that progress for the client can be consistently and quantitatively monitored. For example, if a client started behavioral therapy due to their fear of heights, there would be some sort of systematic exposure therapy approach as an intervention, and there would be detailed milestones that the client would make as they progress through therapy and are able to endure heights and situations that used to previously cause avoidance. So now that we've discussed the goals in behavioral therapy, let's talk about the change processes. There are two main ways that behavioral therapy brings about change through learning processes. The first is stimulus control, which is classical conditioning. This involves changing the cues or conditions that occur before a behavior occurs. And there's two important terms that behavioral therapists work with. The first is prompts, which are cues that prompt a behavior, like how red lights prompt us to stop. And the second is setting events, which are the environmental conditions that elicit behavior. I'm sure most students can appreciate this when they think about how changing their environment by going to the library to study will bring about more effective studying than staying at home where you're surrounded by distractions. And the second learning process is reinforcement, which is when a behavior is strengthened to increase its likelihood of occurring. There are two types of reinforcement, positive and negative. A common example of positive reinforcement is getting raises while you're an employee, as this increases the likelihood that the employee will stay and also continue doing the kind of work they're doing. And negative reinforcement examples are like how the judicial system will punish people when they break laws. And so the idea of breaking the law, of going to court or jail, is enough to deter people from engaging in certain behaviors. So that was sort of the change process in a nutshell for behaviorism. And now I'm going to talk about the change tasks and the specific interventions used by behavioral therapists and that are common in behaviorism. Behavior therapists draw on a wide range of empirically based interventions. And I'll cover a few of the most common ones here, but there are a plethora of them. Exposure-based interventions are the earliest and probably most studied change task in behaviorism. They are the treatment of choice for fear-based problems such as anxiety and phobias, and they involve gradual yet strategic exposure to a feared stimuli. For example, if a client had a fear of spiders, and sometimes having a fear is fine, it doesn't interfere with life, but perhaps this client is now afraid to go into certain rooms of their house where they've seen spiders before. So on some level, it is interfering with their life now. They would go to a behavior therapist, and their treatment plan laid out by their therapist would likely involve steps such as starting to think about spiders and discussing that experience with the therapist, and then moving on to looking at pictures of spiders. They may be also introducing progressive muscle relaxation so that they can also reduce their own feared response throughout these experiences. Then they would move on to watching videos of spiders, then perhaps seeing spiders in captivity, purposely going to like a pet shop where they have aquariums and big spiders in there perhaps. And then also moving on to purposely seeing spiders in their natural environment, maybe going outside in the evening when you can see spiders and webs in the corner of your house somewhere. And potentially the last goal would be actually holding one. You could visit a wildlife center where they showcase different species, and you could hold a tarantula in your hands. And that would be a huge sign for the client that they have made progress, and would likely build up so much confidence that it is very unlikely that a fear of spiders would present itself again in their life. And a plan like this involves systematic desensitization to the stimulus, which is spiders. This happens with almost everything. Novelty wears off. This plan involves systematic desensitization to the stimulus. And each stage of this plan desensitizes the client to help them build up their self-esteem and confidence, so that they're also more likely to move on to the next stage. Relaxation-based interventions are also another popular one and very well researched and studied. I personally often introduce progressive muscle relaxation to clients. There's a lot of YouTube videos that will guide you through it, and it's a way to start consistently practicing an ability to lower one's stress. Response prevention interventions are a variant of exposure-based interventions, and they are often used to help prevent obsessive compulsive rituals. Since compulsive rituals often arise due to fears within the clients, the behavioral therapist works with the client to develop strategies and a plan on what to do as an antagonist to the usual response, which again could also be something like PMR. But this is again done strategically, perhaps starting with the easiest situations for the client to try and intentionally change their ritual. And by following this strategic path, the client will build up confidence at each stage and be more likely to continue on until their obsessive rituals are no longer interfering with their life and can break free from that compulsion. There's a few more popular strategies that I won't discuss, but I'll at least mention, such as operant strategies, social skills training, and modeling. Now is a good time to jump into the therapeutic relationship or therapeutic alliance and what that looks like in behavioral therapy. In behavioral therapy, the therapeutic alliance and a strong therapeutic relationship is certainly useful, but it is not necessary and not a sufficient condition for bringing about therapeutic change in clients. A behavior therapist focuses more on structuring sessions and collaboratively establishing goals. A behavioral therapist will take responsibility when change is not being made and will adjust the treatment plan accordingly. One of the ways I see a behavior therapist and what I really respect about this approach is that they are very similar to a personal trainer at a gym. A really good personal trainer at a gym wants to get themselves fired. They want to get their client, the person new to the gym and the whole world of fitness or whatever their goals are at the gym, they want to get them very well accustomed to using it all themselves, even to the point where they know how to lay out workout plans and lay out diet plans and things like that. A behavior therapist wants to do that. They want to get themselves fired by the client so that the client can manage it themselves. As previously mentioned, there is a lot less focus on the talk part of this approach to therapy, and the behavior therapist is much more like a coach or director for changing behavior than they are a friend that listens deeply and compassionately. And this is intentional because it has been shown to be effective. It's so effective that many behavioral approaches to therapy can even be delivered in a self-help form, such as books like Mind Over Mood, where the client can direct themselves and doesn't even need a therapist with them. The last part of this video, the last section I'll touch on, is the evolution and variations of behavioral therapy. Since behavioral therapy is grounded in empirical inquiry, it has continued to evolve in response to new findings. The most significant and likely most popular is the incorporation of cognitive processes in its approach, which is why cognitive behavioral therapy, or CBT, is so popular today. In fact, there are very few behavioral associations or approaches that only focus on behavior. And this is due to the research and findings that has supported the evidence of focusing also on cognitive processes. And today, right now, there is a growing popularity in acceptance and commitment therapy, or ACT, and this is often argued as the third wave of behaviorism. It is sort of like a break from a medical approach that focuses purely on improving symptoms and instead focuses on developing psychological flexibility. There are a few other variations I think are worth mentioning, and I'll briefly touch on them here. There is behavioral medicine, and this has been widely adopted into healthcare settings as getting people to change their behaviors, whether it's doing more of something or less of something, can have significant changes for their mental health. There's also multimodal therapy, which had the goal of broadening the behavioral approach to include more aspects of the client's life. That had also been empirically demonstrated to be important and worthwhile focusing on. And then there is functional analytic psychotherapy, which had a big focus on improving interpersonal relationships and was developed as a response to behavioral therapy not being effective in many cases for personality disorders or similar disorders like that. But most of, if not all, the variations and evolutions will still follow closely with behavioral therapy's learning principles. So I hope you found this video informative and valuable on some level. It's part of my series of breaking down some of the main fundamental approaches to psychotherapy. Behaviorism, like any other approach, isn't a one-size-fits-all, but it does resonate with a lot of people and a lot of therapists and is often a treatment of choice for large organizations. If you're interested in content like this, please feel free to hit the subscribe button or like this video, as I'll be continuing to make more content in this space. Thank you for watching.